Hello everyone! Today I'd like to bring to your attention a topic of great relevance to the area of perinatal nursing, which is skin-to-skin care. The idea of skin-to-skin care is that the infant be placed directly onto the mother's bare skin following birth. It is considered to be the most natural and humane way to care for both mother and neonate in the early postpartum period. In many hospitals today, it is still common to find that newborn babies are being taken from their mother, swaddled in a blanket, and left in a bassinet as their mother recovers from labor. As new research brings forth evidence around skin-to-skin care, we are beginning to see a shift in the healthcare system, one that is moving towards a more relational and family-centered model. The shift to using skin-to-skin care even in critical care situations has shown to increase overall survival rates of babies. It's important for us to talk about this because we as nurses are in a unique position to encourage and educate women on the use of skin-to-skin care for their benefit and for that of their newborn. Nurses have the ability to advocate for their patients and are empowered to make changes to policy. The impact of skin-to-skin care on maternal health and well-being is profound. I'd like to take a look at a few ways that the skin-to-skin approach improves not only the mother-infant relationship, but also maternal mental health and physical health. One benefit of skin-to-skin care after birth is that it helps to prevent postpartum depression. By allowing mother and infant to familiarize themselves with each other, there is a chance for the two of them to form a deep sense of attachment. This bond empowers women in their new role as a mother, improving quality of maternal caregiving behavior and thus quality of life for both the mother and her new child. In addition, oxytocin, a powerful hormone, acts on numerous sensory nerves to aid in decreasing stress and promoting positive breastfeeding outcomes. With decreased cortisol and increased oxytocin, anxiety to the potentially daunting new role is diminished and the mother can better provide for her child. Oxytocin is thought to promote breastfeeding by enabling longer duration of breast milk supply. Skin-to-skin care also decreases the amount of time before initiating breastfeeding and encourages higher frequency of feedings. Physically, skin-to-skin care benefits maternal health in various ways. It encourages faster delivery of the placenta because of reduced stress. The mother is able to get more rest and better sleep quality. It will promote better recovery for the body after any trauma due to delivery. Skin-to-skin care encourages increased wound healing and also decreases the chance of developing post-birth complications. Now that we've looked at the various effects on maternal health and well-being, it's time to take a look at how skin-to-skin care impacts the neonate. Coming into this world after being in the womb for 9 months is a significant change requiring a great deal of adaptation. Skin-to-skin care ensures the most optimal environment for the neonate to adapt to its new surroundings. Maintaining an adequate temperature is critical as the baby makes this transition. Babies who spend time skin-to-skin with their mothers immediately after birth are better able to achieve and maintain thermoregulation. Research has shown that this method is quicker and more successful than the use of blankets or placing the baby in a crib. Being so near to its mother, the neonate will experience lower levels of physiological stress. Babies are allowed skin-to-skin time, often present with less crying and energy expenditure, as opposed to babies that don't have this closeness and may feel vulnerable. Even during painful or uncomfortable procedures, skin-to-skin care enables the neonate to feel safer, decreasing pain response. A study by Mal and Almgren in 2008 showed that the separation and stress in the neonate period can put the baby at increased risk for development of psychiatric disorders later in life. Skin-to-skin care also helps to stabilize blood sugar levels during the transition to extrauterine life and helps prevent potentially life-threatening complications from arising. It also helps to prevent infection by contributing to the development of the infant's intestinal microbiota and thus a stronger immune system. Early development of the brain is influenced by skin-to-skin care as well. Modern neuroscience has found a link between positive maternal stimulations and brain development, even in the early days of life. This is shown by improved language, cognitive, and motor capacities as the infant starts to grow and develop. All of this being said, skin-to-skin care is not always a possibility immediately following birth. There are many potential barriers, including but not limited to overwhelming amount of visitors, complications during delivery that require immediate intervention, pain from C-section, and safety concerns related to effects of consciousness-altering drugs. It is important to reassure parents that delay in initiation of skin-to-skin contact will not inhibit a bond from forming between the mother and child, but that extra effort and time might need to be taken in order to produce the same effects. Thank you for watching this video. I hope that you learned a lot about the benefits of skin-to-skin care and how such a simple change can have such positive effects on moms and babies. I hope that you can also apply some of this to your nursing practice from here on out.